Let me introduce our panel, and this is the order you're going to be speaking. I guess it's a little different from the way you're sitting there. First, we have Rear Admiral W. Craig Vanderwagen, who is a physician and Assistant Secretary for Preparedness and Response. And next is Rear Admiral Ann Shuckett, who is also a physician and Interim Deputy Director for the Science and Public Health Program at the Centers for Disease Control and Prevention. And last is Joshua M. Sharfstein, who is also a physician and Acting Commissioner of the Food and Drug Administration. We're asking you to basically for 5-minute statements, and they become part of the record, and we'll start with Admiral Vanderwagen.
Good morning, Chairman Pallone and Representative Deal, and thank you for this opportunity to visit with you. I offer greetings and thanks from our new Secretary Sebelius for this opportunity to assure that both arms of the U.S. government, of the three, are working together and that we can share experiences, concerns, and strategies for how we'll address this opportunity. Over the past week, you've seen extraordinary efforts on the part of Health and Human Services and the rest of the federal government. For the past 5 years, HHS and the U.S. government made many investments thanks to the support of Congress in the nation's preparedness for pandemic influenza. Now, while the sequence of the events that we've dealt with in the last week, and I'll remind you, we're talking about essentially a week ago yesterday, recognizing 2 cases in California, to now phase 5 in the WHO environment. The events of the past week have proven the value of the efforts that you supported, which included the development of community plans, the acquisition of medical countermeasures, the development of new diagnostics, and the numerous exercises and response plans at all levels of government. I'd like to take an opportunity also to acknowledge and thank Secretary Napolitano for her continued leadership in this environment. She stepped forward very effectively as the principal federal official here, and we work under her guidance overall. Our new secretary was engaged immediately. She reported to the office yesterday morning, and in fact, she was briefed in doing press discussions yesterday morning almost immediately. She is actively involved and concerned about these matters and directing our activities as well. Today I'm joined by my colleagues who currently serve in the HHS leading the response. I want to say just a thing or two about the Assistant Secretary for Preparedness and Response. Congress in 2006 established the authority for this responsibility with the notion that this office would be the principal advisor for the Secretary on public health and medical preparedness and response for health emergencies. And indeed, that's what we're executing at this time. We're trying to work to assure that there is a coherent HHS approach to public health and medical preparedness, and that our response capabilities are coordinated, that the relevant activities of all the operating divisions of Health and Human Services, Centers for Disease Control, Food and Drug Administration, the National Institutes of Health, and others are being conducted in a coherent and targeted way on behalf of and subject to the authority of our new secretary. Our office also serves as the principal entity that coordinates interagency activities between Health and Human Services and other federal departments and agencies, the White House, and state and local officials responsible for public health, emergency, and medical disaster response. In the event of a public health emergency such as the 2009 H1N1 flu outbreak or other medical disasters, Health and Human Services serves as the federal government's lead for all the Emergency Support Function 8, that is the public health and medical response capabilities under the National Response Framework. As the department's lead for that ESF 8 or Emergency Support Function 8, our office works closely with Homeland Security and FEMA to coordinate all federal assistance to supplement states, territorial governments, tribal and local resources in response to public health and medical care needs. We manage the Secretary's Operations Center in the Humphrey Building so that the Secretary has moment-by-moment situational awareness and the ability to lead, coordinate, and direct as appropriate the health assets that are deployed in support of states. The response and coordination for the H1N1 flu outbreak is going well. You will hear from Dr. Schuckett how our lead operational entity at this point, that is the Centers for Disease Control, is moving forward according to plan, adjusting to reality as it intrudes, but doing an exceptionally good job of moving forward to manage this event. The United States governments are focused on saving lives, slowing the transmission of the disease, and mitigating the consequences of this disease. Those are our strategic objectives. Using the guidelines prepared within our pandemic influenza playbooks and plans, we've been able to more clearly communicate our goals, objectives, and strategies to our federal, state, and local partners so that we understand what they expect, they understand what they can expect from us, and that makes a ton of difference in making operations flow and flow well. As you know, the World Health Organization raised the worldwide pandemic alert to phase 5, which is characterized by confirmed person-to-person spread of a new influenza virus and able to cause community-level outbreaks. And Dr. Schuckett, I'm sure, will talk about that in more detail. But prior to that WHO action, we issued several key declarations, including a nationwide public health emergency declaration and 4 emergency use authorizations, which I think Dr. Sharfstein will talk about in his discussion with you. These authorizations were issued to make certain diagnostics available to public health and medical personnel, to allow for the use of certain antiviral products, and for the use of certain N95 respirators. In response to requests received from affected states, HHS recently released antiviral medications from the Strategic National Stockpile to a large number of states. Additionally, Health and Human Services continues to evaluate community mitigation guidelines in those areas where cases have been confirmed through laboratory analysis. And as this outbreak progresses, we will continue to assess these and other guidelines to assure that they are appropriately based on the available science. Over the coming days, we will continue to work with our federal, state, local, and international public health and medical partners to address the needs of this outbreak. Many assets, and you will hear elements of this from my 2 counterparts, are working to develop a vaccine for this virus. NIH, CDC, FDA, and ASPR are all working together to work this process and to avoid the very dilemma that Mr. Dingle outlined for us. We will work with several manufacturers to continue to prepare reference strains from which viral seeds for vaccine production and clinical trials can be made. We will not only focus on the immediate response requirements, but also those that may lie ahead. As this potentially becomes more of a medical care problem, we will see challenges in the medical care system. We are already actively in communication with our colleagues at the state and local level, in hospitals, in emergency rooms, and in primary care settings to anticipate the implementation of their plans for addressing these matters and how we can support, enhance, and fill gaps that may arise in that setting. With that, I will conclude my statement, and you can hear from Dr. Schuckett.
Thank you. I assume that I'm supposed to reference you as doctors rather than Admiral. You prefer that? Okay. Dr. Schuckett?
Good morning, Mr. Chairman and members of the subcommittee. I'm Dr. Ann Schuckett, the Acting Deputy Director for Science and Program at the Centers for Disease Control and Prevention, and I appreciate the opportunity to update you on current steps we're taking to respond to this unique and serious influenza outbreak. Our hearts go out to the people in the communities within the United States, in Mexico, and around the world who have been impacted by this new strain of influenza virus. People are concerned, and we're concerned too. We're responding aggressively at the federal, state, and local levels to understand the complexities of the outbreak and to implement control measures. Our aggressive actions are possible in many respects because of the investments and the support of the committee and the Congress. and the hard work of state and local officials on the front line around the country. Flu viruses are extremely unpredictable, making it hard for us to anticipate the course that this outbreak will have with any certainty. We do expect increases in the number of cases, the number of states that are affected, and the severity of illness. Amid this uncertainty, we hope to be clear in communicating what we do know and acknowledging the uncertainties, clearly communicating what we are doing to protect the health of Americans and help Americans understand the steps that they can take themselves to protect their own health and that of their families and their communities. Influenza arises from a variety of sources, and in this case, we've determined that we have a novel 2009 H1N1 virus circulating in both the U.S. and Mexico that contains genetic pieces from 4 different virus sources. Additional testing is being done on the virus, including a complete genetic sequencing. CDC has determined that this virus is contagious. It's spreading from human to human, similarly to seasonal influenza, likely through coughing or sneezing. Sometimes people may become infected by touching something with flu virus on it and then touching their mouth or nose. There's no evidence to suggest that this virus has been found in swine in the United States, and there have been no illnesses attributed to handling or consuming pork. There's no evidence that you can get this new influenza virus from eating pork or pork products. I want to reiterate that as we look more intensively for cases, we are finding more cases. We fully expect to see not only more cases, but also a greater severity of illness. The specific numbers are less important in understanding the outbreak than the more general patterns that we observe that will help us guide our interventions. Aggressive actions are being taken here as well as abroad. We're working very closely with state and local public health officials around the U.S. on the investigation and to implement control measures. We've provided both technical support on epidemiology and laboratory efforts for confirming cases, and we're working with the World Health Organization, the Pan American Health Organization, and the governments of Mexico and Canada on this outbreak. There's a tri-national team that's working in Mexico right now to better understand the outbreak and to enhance surveillance and lab capacity so that we can better address critical questions such as why the cases in Mexico appear to be more severe than what we're seeing initially here in the United States. And we're working very closely with other HHS and other federal partners to ensure that our efforts are coordinated and effective. CDC has issued many health advisories for individuals, healthcare practitioners, schools, and communities, and these continue to evolve as our understanding of the situation changes. On Monday, CDC issued a travel health warning for Mexico, recommending that travelers postpone non-essential travel to Mexico. We're also evaluating information from other countries and will update travel notices as necessary. As always, people with flu or flu-like symptoms should stay at home and should not attempt to travel. In fact, a key message that we have for people is that there's a role for everyone to play when an outbreak like this is occurring. At the individual level, it's important for people to understand how each of us can prevent respiratory infections. Frequent hand washing is an effective way to reduce transmission. If you're sick, stay home. I can't tell you how many times I've said that this week. If your children are sick, have a fever or a flu-like illness, they shouldn't go to school. And if you're ill, you shouldn't get on an airplane or any public transport to travel. Taking personal responsibility for these things will help reduce the spread of this new virus, as those measures also help reduce the spread of other respiratory infections. It's also important for people to think ahead, to think about what they would do if this outbreak deepens in their community. Communities, businesses, schools, and local government should plan now for what to do if cases appear where you live or work. For example, parents should prepare for what they would do if faced with temporary school closures. We also have additional community guidance so that clinicians, laboratory scientists, and other public health officials will know what to do should they see cases in their community. All of these specific recommendations, as well as our regular updates, are posted on the CDC's website at www.cdc.gov. CDC maintains this nation's strategic national stockpile of medications for the eventuality that they may be needed in a situation such as we face today. As part of our pandemic preparedness efforts, the U.S. government has purchased extensive supplies of antiviral drugs, and our preliminary testing indicates that the virus is susceptible to the drugs we have in our stockpile. We're releasing 1/4 of the state's share of antiviral drugs and personal protective equipment to help states prepare to respond to the outbreak, along with the necessary FDA emergency use authorities to facilitate their effective use. Distribution has already begun, starting with states where we already had confirmed cases, and the Department of Defense and individual states have also stockpiled these antiviral drugs. Whenever we see a novel strain of influenza, we begin the steps to work toward the development of a vaccine in case one is needed. The CDC is working to develop a vaccine seed strain specific to this novel virus, which is the first step in vaccine manufacturing. We've initiated steps so that should we need to manufacture a vaccine, we can work towards that goal very quickly. And rapid progress is being made possible through the combined forces of CDC, NIH, FDA, BARDA, and the manufacturing community. Finally, it's important to recognize that with the strong support of the Congress, there have been enormous efforts in the U.S. to prepare for this kind of outbreak and for a full pandemic. Our detection of this strain in the United States came as a result of that investment, and our enhanced surveillance and laboratory capacity are critical to understanding and mitigating this threat. While we must remain vigilant throughout this and subsequent outbreaks, it's important to recognize that at no time in our nation's history have we been more prepared to face this kind of challenge. As we face the challenges in the weeks ahead, we look forward to working closely with the subcommittee to best address the evolving situation. Thank you.
Thank you, Dr. Shuckett. Dr. Sharfstein.
Thank you, Chairman Pallone, Ranking Member Deal, Ranking Member Barton, Chairman Waxman, Chairman Dingell, and other members of the committee. Thank you for having this hearing. I'm Dr. Joshua Sharfstein, Principal Deputy Commissioner and Acting Commissioner of the U.S. Food and Drug Administration. FDA protects the public health in this type of situation by facilitating access to safe and effective human and animal drugs, human biological products, and devices. FDA is part of a team led by the Department of Health and Human Services, working closely with the department, our sister agencies, other U.S. government agencies, the World Health Organization, and foreign governments. We are responding to this threat. I appreciate this opportunity to discuss the agency's response, including our approval of several emergency use authorizations earlier this week and the efforts of several internal FDA teams. Let me turn to the emergency use authorizations. Section 564 of the Food, Drug, and Cosmetic Act, which was added by the Project BioShield Act of 2004, which I know came through this committee, permits the FDA Commissioner to issue an emergency use authorization following a determination and declaration of a public health emergency. This allows the use of an unapproved product or an approved product for an unapproved use in a declared emergency.
Dr. Sharfstein, I think some of the members are having a hard time hearing you. Just pull the mic a little closer to you.
Sorry about that. Is that
That's
better?
better, yeah.
I apologize. I was talking about emergency use authorizations, and FDA can issue these in an emergency under 4 conditions. First, we've defined that the product can cause a serious or life-threatening disease or condition. Second, based on the totality of the scientific evidence, it's reasonable to believe the product will be effective against the disease or condition. Third, that the known and potential benefits of the use outweigh the known and potential risks. And fourth, that there's no adequate, approved, and available alternative. This past Sunday, the acting HHS secretary did issue a public health emergency declaration and then followed that with declarations justifying the emergency use of certain antivirals, in vitro diagnostics, and personal respiratory protection devices. Let me just briefly describe these emergency use authorizations that FDA went ahead and issued as a result or following that declaration. Two of them pertain to drugs. Tamiflu is a drug approved, it's oseltamivir, for the treatment of uncomplicated illness due to influenza and prevention of influenza in patients 1 year and older. Relenza is approved to treat acute uncomplicated illness due to influenza in adults and children 7 and older who have been symptomatic for less than 2 days, and for the prevention of influenza in adults and children 5 years and older. One of these emergency use authorizations allows for Tamiflu also to be used to treat and prevent influenza in children under 1 year. In addition, under both authorizations, both of these medications may be distributed with information pertaining to emergency use to large segments of the population without complying with the label requirements that otherwise are applicable to dispense drugs. They may be distributed by a broader range of healthcare workers, including some public health officials and volunteers, in accordance with the state and local laws and public health emergency responses that I know are being planned around the country. The third one related to a PCR flu panel diagnostic test for the CDC, which allowed the CDC to distribute to public health labs around the country a diagnostic test that can presumptively diagnose this particular infection. And for all of these emergency use authorizations, the way it worked is CDC applied. We worked very closely with CDC over the weekend to make sure everything was there to get the right information to people, and then we approved them on Monday, starting early in the morning. This particular diagnostic test amplifies the viral genetic material. A positive result indicates presumptive infection. A negative result by itself does not exclude the possibility of infection. The fourth authorization permits HHS to deploy certain disposable respirators from the Strategic National Stockpile for use to reduce exposure to airborne germs. These products, when used properly and in accordance with information that's provided, may help reduce the chances of getting sick. They do not eliminate the risk of illness or death. They should always be used in conjunction with other infection control measures such as frequent hand washing, and should be done consistently with the advice and guidance provided by the CDC and other public health authorities. Let me just turn for the last minute to talk about how FDA has organized itself to respond to this challenge. As soon as we became aware of this last week, I asked Dr. Jesse Goodman, FDA's acting chief scientist and deputy commissioner for scientific and medical programs, to coordinate and lead FDA's efforts. Dr. Goodman is a world expert in infectious disease. He previously directed the Center for Biologics and has extensive experience in issues related to influenza vaccine production and evaluation. We've changed the way FDA is managed for this process. We're using an incident management approach with Dr. Goodman as the leader, which includes 7 substantive teams that are cross-cutting and includes staff from across the FDA and all FDA centers. These teams work with the department, CDC, other agencies, national and international partners, and they are the vaccine team, the antiviral team, the in vitro diagnostics team, the personal protection team, the blood team, the shortage team, and the consumer protection team. We also, in the incident management approach, have an operations section, a logistics section, and a communications section. We have senior level health, international, and legal advisors. Let me just very briefly explain how these teams work. The vaccine team is working to facilitate the availability of a safe and effective vaccine to protect the public from the 2009 H1N1 flu virus as soon as possible. Now, having that vaccine ready is the goal of the team. There's a completely separate question, and that's going to depend on the status of the epidemic, of whether and who that vaccine would be recommended for. But for FDA, we want to have a vaccine that's safe, effective, and available as quickly as possible. Part of this team starts in the lab. We're growing the vaccine and trying to genetically engineer a reference strain that could be used for vaccine development. We're already preparing reagents that will be needed to help manufacturers produce and test the vaccine. We're trying to think through what clinical evidence would be necessary before we can conclude that the vaccine is effective. This team is working with BARDA and HHS to have extensive consultation with the vaccine industry already as this goes forward. I actually went out and met with the vaccine team earlier this week. They are scientists, they're physicians, they realize how much is at stake for this country. There's the antiviral team, whose goal is to identify and evaluate antiviral drugs to prevent and treat illness and to facilitate access to these medications. This is the team that led the effort to review the emergency use authorizations with CDC. They're also in extensive communication with manufacturers about other options to treat this infection, particularly if it becomes severe, and is working very closely with other regulatory agencies around the world. This team used its expertise to identify the right dose for kids under 1, and we're hearing from a lot of countries around the world about how they did that. We have an in vitro diagnostics team that approved that test I was talking about that CDC is distributing, is already working with manufacturers on the availability of other tests, as well as current diagnostics just for basic identification of influenza. The personal protective equipment team did the mask emergency use authorization, and they're also in continuous contact with the key manufacturers to make sure that we can get the appropriate supplies of these products for the American people. There is a blood team. The blood team is dedicated to the safety and availability of blood products needed for transfusion by the American public during this outbreak. The main focus of the blood team is to make sure there's adequate blood just in general, because blood is very important for so many different people and patients around the country, and that the response to this just doesn't reduce the number of donors. But they're also starting to think through whether there's any potential risk to the blood supply, and they're engaging other regulatory agencies. So far, they're not. There's nothing that they're recommending in terms of particular controls based on their understanding of influenza. We have a shortage team that's working very closely with manufacturers to, particularly around the issue of how they can expand production of key medications, as well as working with HHS and others about spot shortages that are occurring. And finally, we have a consumer protection team that cross-cuts across all the different parts of FDA to monitor for scams, dangerous products, and things that may be marketed that could cause harm to people as they are worried about this situation. So in conclusion, FDA is fully committed and engaged in protecting the public's health during this difficult time. Among us are laboratory scientists, medical reviewers, epidemiologists, product experts, and field inspectors. We will bring every skill and every resource we have to this critical mission. Thank you very much for the opportunity to testify today. I welcome your ideas and your questions.
Thank you, Dr. Sharfstein. Thank all of the panelists.